Hello, everybody, and welcome. I'm Peter Goldstein, founder and Chief Synergy Officer for We Did It Health. And I am so excited for another wonderful presentation. And this time it's going to be more of a conversation. So bring us your questions. I have Dr. Rizwan Bukhari, Dr. Riz, with me today. And he will be very happy to answer all kinds of questions about health and lifestyle and cardiovascular disease. So a little bit about Dr. Riz is uh, really, can we, he asked the question, can we prevent and halt and even reverse cardiovascular disease? And Dr. Riz says, absolutely, yes, we can. And that's what he advocates for. So Dr. Riz became board certified in lifestyle medicine in 2019. And lifestyle medicine that certainly includes food and all the other lifestyle aspects. And maybe Dr. Riz can tell us a little bit more about it. He is committed to helping his patients live a healthy lifestyle to prevent and even reverse chronic diseases. He founded the North Texas Vascular Center, offering diagnostic services and minimally invasive outpatient procedures to prevent amputation and limb salvage. Dr. Riz also hosts a segment on Healthy Lifestyle Solutions podcast titled Doctor in the House. There, he educates listeners on the risk factors associated with chronic diseases. So, with that, I would like to invite you to join We Did It Health and join our community where we are organized in groups that we call passion pods. So, talk about your passion, network with other people who are very passionate about similar topics, and help us all inspire hopeful curiosity with people we care about. So with that, I would like to welcome Dr. Riz. Uh, Hello and welcome. And everybody, please post your questions. This is more of a conversation today. Normally, often we have a presentation and slides, but this is a free flow conversation, and Dr. Riz is happy to answer questions about cardiovascular disease and especially and lifestyle medicine. So welcome. Hi.
Hi, Peter. It's nice to see you again, and it's
Thank you.
great to be
So
here.
good to see you. Thank you. Welcome. Well, with that, would you like to tell everybody this really amazing lifestyle medicine, and everybody, I think you've noticed that there's board certification for doctors in lots of different areas, and it was such a thrill to see in recent past a board certification for lifestyle medicine, which includes diet. So Dr. Riz, will you tell us more in depth about what lifestyle medicine is and the American College for Lifestyle Medicine?
Sure. I'm pretty long-winded. I hope that you don't mind, because there's a little background behind all this for me. My wife and I, Maya Acosta, who runs the Healthy Lifestyle Solutions podcast that you mentioned, that I'm in on, we got into whole food plant-based nutrition for our health many years ago, and one of the pathways to doing that was we had started to learn about something called the blue zones, and that's areas in the world where people live long, healthy lives. In fact, they were statistically shown to have a higher proportion of centenarians, or people who live to be over 100, but not just living to be over 100, but 100 and healthy. So it's not like they were debilitated in a nursing home or anything like that. And a guy named Dan Buettner, sponsored by National Geographic, went and profiled and highlighted these places and looked at the people, and then wrote a book called The Blue Zones. And there were some characteristics that people, all these places had, even though they were spread out all over the world. One was here in the United States in Loma Linda, one was in Costa Rica, one in Japan, one in Greece, one in Italy. And so even though they were kind of all spread out all over the place, they had common characteristics. and so what they did is they kind of broke it down and looked at these common characteristics. One of the primary ones was that all of these societies ate a plant-forward or plant-based diet, primarily plant-based, and that was a big deal. Another one was that all of these places had the people got a fair amount of exercise on a regular daily basis, whether it was I'm not talking about massive bodybuilding or Olympic running. We're talking about regular daily reasonable exercise. And so they didn't hop in the car and drive 2 blocks to the 7-Eleven. If they were going to the market, and they didn't have 7-Elevens, but if they were going to the market, they walked there. And they gardened on a daily basis, and they went for evening constitutionals after their dinner. So exercise was a regular part of their daily activities. And there were other characteristics having to do with lifestyle, which had to do with getting adequate sleep and some form of spirituality and social connections. And so there was, again, a lot of an avoidance of major use of risky substances like alcohol and drugs. And so this was very interesting to us. And, we really kind of adopted these concepts as our own as well. In leading to a more healthy lifestyle. And then we came across the American College of Lifestyle Medicine, which is at that time a fairly young organization, and it was a more organized Western program of physicians and healthcare professionals who had the pillars of lifestyle medicine, and these pillars of lifestyle medicine very closely reflected those findings in the blue zones. And so I was naturally attracted to the American College of Lifestyle Medicine and that organization and what they were doing. And so we joined that, and they had a board certification pathway. So I became very interested because by this time I had adopted these concepts and was teaching these concepts in my practice to my patients to live a better and healthier lifestyle. So I satisfied the prerequisites for the exam, studied for the exam, and took it back in 2019. So that's how I kind of became board certified in lifestyle medicine. And what I'd like to say about that organization is that I love what they stand for, and that they're trying to show that if we lead better, healthier lifestyles, we can prevent a lot of these chronic diseases from occurring. And even if you have disease, it's not too late to adopt a healthy lifestyle, because you can halt the disease or even reverse it, and certainly make yourself healthier than you would have been had you continued down the path of kind of what I call the standard American diet, which gets you down the path of standard American diseases. The American College of Lifestyle Medicine is a great organization. When I joined just a few years ago, there was 3,500 members. And despite the pandemic, they grew from 3,500 members to now they've got over 10,000 members in just the last 3 or 4 years. So I think there's a growing awareness, kind of what you guys are doing with We Did It Health, as far as grassroots movement, spreading awareness, making people aware. And so people are finding out about this organization and growing as well.
Oh, beautiful. So yes, they're an amazing organization and growing, and the whole movement is growing. So it's just so wonderful to see that there is the solution to prevent and even reverse chronic diseases. We have a question from Miriam Shiro, I believe is how she pronounces her last name. And she says, well, first of all, she says, thank you, Dr. Riz, for this. And she says, all my sisters already had bypass surgery, and that's kind of amazing. All her sisters, I mean, it used to be that only men would get, or mostly men would get the heart disease, but here it is. I guess that just shows us that that it's the numbers of people with heart disease are just growing so much, and maybe that's something you could tell us. But she's saying that she's here so that she doesn't end up with bypass surgery like her sisters do have, and she's looking to learn about the lifestyle. So, what would you advise Miriam in her quest to bypass surgery?
Yeah, that's a really good question, and that's really right at the heart of what we're trying to teach. I joke that I'm trying to put myself out of business. If I can teach people how to prevent the disease, then they won't end up on my operating room table. And I think that uh, uh, there's a lot of ways to answer this, and a lot of things I can say about it. Um, First off, to address what you said about women and men, I think that there's kind of this conception that women have the disease less, but that's actually not true. By the time women reach menopause, they begin to catch up to men in the levels of cardiovascular disease, and so at least in current day, we it's a fairly even split in the amount of disease, and it also may have been that in the past, decades ago, women sought healthcare less, and so therefore they got the bypasses less as well. But I don't think we see that anymore. Now, to address the thing about your sisters and you, the we, they probably lived a certain type of lifestyle, which led to the development of atherosclerosis, or plaque buildup in the coronary arteries of the heart, which then led to the need for bypassing those arteries, fixing them in one way or another. And what you can do to try to not let that happen is to adopt a healthy lifestyle, which which will help you not develop those problems. Now, the likelihood is that you already got the basis of atherosclerosis. We almost all do. Studies show that 80% of people by the time they're 20 have the beginnings or the foundations of atherosclerosis in their arteries. And then it develops insidiously over the course of a few decades. And, how fast it occurs and who it affects depends on your lifestyle choices for the rest of your life. And some underlying genetics, no doubt about it. But genetics is not the primary thing that determines our outcome. The environmental forces at work, especially our diet, is what turns on and turns off these genetics and genes and things like that form disease. And what they've shown is, we've seen is that if you can keep your cholesterol down below 150, and if you take in a great deal of fiber on a regular basis, and you eat a healthy plant-based diet, and you do anything you can do to manage your chronic conditions, you can reduce your risk of cardiovascular disease. Now, I won't say you can eliminate it, because we all, the reality is we all succumb to something at some point in our lives. Even those centenarians I talked about in the blue zones eventually passed away, but it's a matter of living a longer, healthier life. So, what I would say to you is that you can adopt a healthy lifestyle, primarily focusing on whole food plant-based nutrition, and incorporate exercise and get regular sleep on a regular basis. And it's a much more detailed answer than just those things. We could delve into each of those things much more carefully. But the primary risk factors in atherosclerosis are cholesterol, diabetes, high blood pressure, and obesity. And if you have any of those conditions, then you certainly need to work on those. And again, a whole food plant-based diet is the best way to primarily affect those. And if you have those conditions, you all should be on medications for them. But I will say that the medications are just managing the disease. They're not affecting the disease at its core.
Beautiful. Thank you for that. Miriam then also says her concern is that about genetics. Now, how much influence do genetics have on heart disease?
So genetics, I again have a couple of things to say about that. We are all 99.999% genetically identical. So no matter where you come from, all humans are genetically identical. And it's just the expression of those genes which makes us different. And the expression of the genes is a science called epigenetics. And epigenetics is what turns on and turns off different sets of genes. And so one set of genes might be turned on and you get brown eyes. One set of genes might be turned on and you get blue eyes. Similarly, in disease processes, some genes can be turned on to allow diseases to occur. Some genes can be turned on to prevent diseases. And so there is some genetic predisposition, and then also there are some populations that are just more genetically predisposed to some things. But genes really are only responsible from anywhere from 5 to 20% of our chronic disease. That's kind of, asking and looking at different diseases and getting different opinions from different experts. But we all agree that the vast majority of disease has to do with environmental exposure. And environmental exposure basically means, what do we expose our bodies to on a regular basis, on a daily basis? The most extreme of those, when you think about it, can be something like tobacco exposure on a daily basis. We know that causes cancer. We also know that if you go expose yourself to plutonium, that's even more extreme. You'll get cancer, or radiation. So those are environmental exposures that rapidly accelerate the production of disease. Then there's other exposures that are more insidious, and that one of those is our food. We expose ourselves to food as much as 3 or 4 times daily, when we're eating. And so that is an environmental exposure that then that food, depending on whether it's good food or bad food, toxic food or healthy food, will certainly affect your health by turning on and turning off different processes in the body. And if you can imagine, if someone's eating bad food every day, sugar, salt and oil, processed foods, lots of meat, they're setting themselves up for getting all sorts of chronic diseases such as diabetes, obesity, hypercholesterolemia, atherosclerosis, and hypertension. Those are all scientific facts proven with studies. And then, but if you feed your body full of whole foods such as fruits and vegetables and whole grains and legumes, natural foods on a daily basis, then you're certainly giving your body the most healthy foods that are turning on the healthier processes. We know that whole food plant-based diets reduce the risk of prostate cancer and breast cancer, and they're also good in reducing the incidence of recurrence in people who've had breast cancer and prostate cancer. We know that a standard American diet causes about anywhere from 9 to 13 different types of GI tract cancers, whereas whole food plant-based diet does not cause cancers. So there's these are the ways that the diet, which is our most frequent exposure, can affect our genetics to turn on and turn off different disease processes. And so it's not too late, even after a few decades, to change to a healthier lifestyle and start to begin to improve your health, turn off the bad genes, turn on the good genes, and improve your health. So yeah, genetics is there. And the other way I look at it is genetics is what loads the gun, but it's lifestyle that pulls the trigger. You can have a good lifestyle and not pull the trigger, or you can have a bad lifestyle and pull the trigger.
Yes, I've heard that many times. Genetics loads the gun and lifestyle pulls the trigger, and it's just so amazing because it is the lifestyle where we can make our choices.
Yeah, I will.
You're
Let me interject here by saying, kind of a motivational factor is to say that, if you do the same thing over and over again, you cannot expect a different result. So if you live the same lifestyle as your sisters, you can expect the same result. And so sometimes my patients will, but if you change your lifestyle, then you can hopefully change the outcome. And there's people who come into me and say, my dad had a heart attack, my mom had a stroke, my uncle died at the age of 42 from a heart attack, so I'm doomed to die. And my answer is yes, you are, if you do the same things they do. So let's try something different. Let's look at things differently. And if you change your lifestyle, you're at least giving yourself a chance to live a different life.
beautiful. Well, and I would like to also welcome at this point, not that she'll be on air, but I see that Maya is with us, and hello, Maya, and
Hi,
so
Maya.
nice to have you. Yes. Miriam has been vegan for 10 years. Maybe this is a good place to get into a little bit of a conversation between the differences of being vegan or whole food plant-based, uh, and along those lines, also perhaps you know what, and it's a follow-up question. I'll save it for a follow-up question. But what are the major differences and distinctions between vegan diet and a whole food plant-based diet?
Well, that'd probably be part of my answer, anyways. And so, yeah, not speaking to Miriam's lifestyle because I don't know what her lifestyle is like. And there is a spectrum of what we call plant based. Okay, and so you might hear me throw in the term whole food plant based a lot. And we've kind of gotten lazy, and sometimes we say plant based, but plant based just means that you're not eating meat based foods. But whole food plant based really is very specific about a particular lifestyle. And so a vegan diet is a plant based diet. And there's a whole spectrum of the diet there. There can be what I call on one end of the spectrum, kind of very similar to a standard American diet, where there's a lot of oil, salt, sugar, and processed foods, a lot of fried foods. They, what I love about the vegan diet today is that it's a tasty diet, and it's a great so for those people who thought being a vegan in the past was a dull, bland diet and eating salads all day. Well, that's not the way a vegan diet is. It can be quite tasty and very satisfying, but that's one end of the spectrum where it doesn't confer much health benefit over the standard American diet. Yes, there's no meat, no dairy, no cheese, no eggs, and there is some health benefit conferred from that. But if you're still eating a lot of salt, oil, and sugar, eating a lot of fried foods and a lot of processed foods, it's not much healthier than the standard American diet. On the other end of the spectrum is the whole food plant-based diet, which is salt, oil, and sugar free, and then there's a whole bunch of places where you land in between, and all of those are plant-based diets. And I always say that at home, Maya and I are very, very good because we make our own food and we get to determine what we put in there. When we're eating out, whether we're traveling or going to a conference or something like that, we don't have as much control. We might be eating a plant-based diet and even whole food, but we don't get to control how much salt, oil, and sugar are in there, for example. So, that's not everybody lives a perfect diet all the time, unless you're really just literally preparing it yourself. But what we've seen is that if you are whole food plant-based, SOS free, that confers a significant benefit over the standard American diet. So that's and everybody falls in a different place, and there's different reasons for doing it. I got into this space, I call it, for health, but I very quickly became an ethical vegan once I learned more, and an environmentalist. So I kind of call it that triangle of health, animals, and environment. And most of the time, Maya and I adhere to a really nice whole food plant-based diet, like I said, especially at home.
Yes, beautiful. And myself, I started out from the health perspective, and I lost 50 pounds, and my cholesterol and triglycerides that were off the charts have come to normal. And living a mostly, and I look at myself and compare people my age who are where I was years ago. I think I'd probably be 100 pounds heavier at this time, and probably on all kinds of meds, and
Mm-hmm.
I'm not on any prescriptions at this point. Um, so so back to Miriam, who's showing her appreciation, and she says she feels at ease now. And Miriam, there's a lot of hope, and definitely take a look at tweaking your diet, and making sure that you're staying on a more than a vegan, more than just vegan, but some of the things that Dr. Riz talks about with the oil and processed foods.
Yeah,
Um,
if I might comment, one thing that I feel like I got to combine the best of the kind of my standard Western medicine, where and also now this kind of lifestyle thing. And one thing though that I'm big on is data points and feedback. And if we don't measure things, we don't know where we stand. We also don't know where these tweaks and these changes, if they're having a positive effect on us. And so, Miriam, I think along with living a healthy lifestyle is also getting checked up. Finding yourself a healthcare provider who understands what you're doing and can kind of work with you to see and make sure, especially with that family history, make sure that you're doing the right things. They can do some simple testing to kind of check your health. I do things like I wear the watch, which has a whole lot of health feedback for me, heart rate and respirations and oxygen saturations. And these things are going to continue to get better, where they'll start telling you your blood pressure. So I am a scientist at heart too, in the sense that, and that's good, because what I'm preaching here as far as the diet is scientifically based and scientifically proven. It's not just a fad. So part of that is getting feedback. You can call it biofeedback or biomedics, and these things then can help you tweak again your health. And there's so much more to it. There's what is your weight? Your body mass index. Checking out your labs. What is your cholesterol? What is your hemoglobin A1C? What's your blood pressure like? You need to know all these things so that if there are these issues, you can focus on them. So sorry for the interruption, Peter.
No, no. Well, thank you so much. That's beautiful. I appreciate your input, and that's why we have you as a guest. I, you have such wonderful wisdom and information to share, and you touched on being science based, and I would like to add that this entire whole food plant based. I don't know, call it a movement. Most people don't like to call it a movement, but this whole food plant-based lifestyle mindset is very much science-based. And would like to mention Dr. Greger's nutritionfacts.org, where Dr. Greger's organization, their mission is to review all the nutritional studies in the English language, and then process that information. And you can look up just about everything, any questions you have about the research. And this is all based on unbiased, unsponsored, medical, peer-reviewed, the best research possible. So everything that Dr. Riz talks about, and all the doctors in the whole food plant-based sector, they're all science-based.
I agree, absolutely, 100%.
Yes. Do you have any sense of how many studies Dr. Greger's organization has reviewed?
Oh my goodness, it's got to be in the tens of thousands, if not hundreds of thousands, because his organization has been going for a long time. He has a large group of people reviewing these studies. I mean, he's got thousands of videos up there. There's kind of, I call it the rabbit hole. You can go search any topic, and just put in your general words, and there's lots of videos that are going to come up and give you plenty of viewing time on information. So and especially the more common ones. So if Miriam wanted to go research cardiovascular disease, if she just put that in, she's going to get dozens, if not hundreds, of videos to review.
Absolutely. And what amazes me is Dr. Greger published the book How Not to Die, and the book is like that thick. And the last third of the book is references. He refers, I mean, that thick, a third of this thick book is just citing references. It's amazing. So it's not just fad diets, it's not just somebody got healthier by something, but it's very deep science. Well, let me move on here. We have Linda. She says she has mild corroded plaque. That's such a hard word for me. Can this condition be improved by following a whole food plant-based diet?
So the simple answer is yes, Linda. I think so. And this is you're kind of the ideal candidate to, if you're not already following the lifestyle, to go ahead and be aggressive about it. Because that mild carotid plaque is the beginnings of plaque deposition. And that's where, if it gets worse, if it continues to deposit plaque in that area, it's going to put you at risk of having stroke. So mild right now means that you've picked it up before it's become a problem. And it's the great thing about it is it's such an easy place to monitor, because obviously you had it picked up by some sort of imaging study, most likely an ultrasound, but it could have been also a CAT scan or an MRI. But it's so easy to monitor with ultrasound. Now you can make lifestyle choices that hopefully will halt this disease and maybe even reverse it. So if you're aggressive about that whole food plant-based lifestyle, over the course of years, you should see that this should not progress. And so, yes, I think you're in a great position to prevent yourself from having a stroke.
Beautiful. So moving on to Vegan Knowledge, JJ, she wants to ask about salt. Could you explain how, if your whole food plant-based diet is no salt, then she's asking if about iodine and necessity of salt in our healthy cardiovascular health.
Yes, that's a very nice question. So yeah, I think the consensus is that well, I guess I'll start this by saying the daily recommended amount of the RDA for sodium is 1,500 milligrams, but the average American gets somewhere between 3 and 4 times that, somewhere around 4,500 to 5,000 milligrams on a daily basis. So we're getting we all take in way too much salt as a society than we should, and the idea there is salt is directly responsible for increasing our blood pressure. And then that blood pressure, hypertension, is one of the main risk factors for cardiovascular disease. So that's how taking in too much salt can contribute to cardiovascular disease. And so in my patients and in general, we know that by eliminating salt from your diet, it helps reduce the blood pressure and or cure blood pressure problems in at least 50% of people. So that we know it's a significant contributor to hypertension in our society. There's salt in almost everything out there. When you eat out, they put a lot of salt in your food. Processed foods have a lot of sodium. Even the healthier foods that we tend to buy from the store, if you go to the store, you have to be careful about that. If you're buying canned beans, you can buy a can of beans with 700 milligrams of salt in them, or you can buy a can of beans with 60 milligrams of salt or sodium in them. And so you do need to be cognizant of that. And so if you're very aggressive in eliminating any added salt to your diet, it can significantly help your hypertension and then therefore reduce your cardiovascular risk. And so you don't need to add salt in order to get the amount of sodium you need. There is salt in all foods, most foods naturally. There's sodium in celery. There's sodium in all of our foods. So a good varied whole food plant-based diet is going to get you all the sodium you need on a daily basis. And at the same time, be healthy in the sense that you're not taking in too much and not contributing to the risk for hypertension and therefore the risk for cardiovascular disease. As far as iodine, the iodine in salt that you buy on your table salt is added iodine. So you don't have to use table salt to get your iodine. You can get iodine from other healthy sources.
So then eating a whole food plant-based, minimal salt, sugar, and oil, and a large variety. And I think I've always noticed that a variety of foods is always part of the recommendation. So with all that variety, then the iodine, the sodium, everything is available through, and we do get all that through the variety of food.
Yes, absolutely. And there's very few things that you might point to that you won't get on a good whole food plant-based diet. Probably the only thing is vitamin B12. That's something that is well known in the vegan community, and that's not really a consequence of the diet, but it's more a consequence of modern day public hygiene. And then because our food sources are so clean that we don't get the bacteria that help us produce the B12 because the foods are so clean. In the older days, people would get that in their diet. And some people think that we need to eat meat-based foods in order to get that B12, but the reality is those are just supplemented anyways. And so the only supplement I really recommend as a necessity for vegans and whole food plant-based diet eaters is a B12. So, for example, I take a B12 vitamin supplement once a week. People do talk about vitamin D, but that's not a vegan specific thing. That's we as a human species have a vitamin D deficiency because we just don't get out in the sun as much as we used to. So that's not a diet specific thing.
Wonderful. Vegan JJ, let me see it here. She also talked. So there's lots of other aspects of a healthy diet, but she was talking about specifically about acid reflux. So she's noticing that she's not getting acid reflux, which she used to get on a
Mm-hmm.
regular on the standard American diet. Um, can you list? I mean, there's probably 50 different things that besides chronic diseases where a whole food plant-based lifestyle addresses. So aches and pains. I mean, can you name some of these other things? Acid reflux, aches and pains, and just everything else besides the major chronic, and maybe
Yeah.
even list the major chronic diseases for everybody.
Yeah, that's very interesting. And I think that's speaks to an underlying truth. And there's, again, I have a whole lot of ways to kind of express this thought. There's one thing that I will say is that as most of us walking around didn't realize how bad we were feeling because we kind of just that was our new norm. So there's a bunch of people walking around thinking the way they feel is just the way they're supposed to feel. And then when they improve their diet and lifestyle, so many things improve and they go, gosh, I didn't know how good I could feel. I feel so much better than I used to. And because they've been living for decades eating kind of this certain way, putting toxic foods and bad foods into their body, and it just makes them feel a certain way. And so, there are the major diseases that I talk about, major chronic diseases that are significantly impacted by your diet. Those being type 2 diabetes, hypertension, hypercholesterolemia, triglycerides, obesity, hypertension. You actually see significant changes in all of these numbers just on a few weeks once you've changed your diet. And those are all major chronic diseases that cost our country hundreds of billions, if not trillions of dollars a year in treatment and in medications. And then, you go and change your diet and those things go away. So it's not that you're just managing them. You're actually treating the underlying root cause, which makes the disease go away. And, but at the same time, and this speaks to what you're talking about, there's a whole lot of these other vague symptoms that tend to improve. And I've seen people talk about aches and pains in their joints, just a general malaise or tiredness. Because I think, we know that the inflammation in the body goes away with a whole food plant-based diet, whereas the standard American diet is a very inflammatory diet. You're very acidotic, whereas on the other diet, it's very alkalotic, and so the inflammation goes away and you feel better. So there's, as I said, aches and pains in the joints, the general feeling. So I've had lots of people talk about their allergies improved. And this is the one that, is it JJ, I think, just mentioned that it's one of the most common ones I hear is that my gastric reflux went away. So yeah, it's not unusual. And I point out the documentary Forks Over Knives all the time to point this out because they were with this individual in the movie. They were dealing with just a specific subset of just a few diseases which they were focusing on. But that person had filled out a questionnaire, and when they were reassessing, not only did they dramatically improve their major endpoints, but that person had I think a list of like 21 other relatively non-specific and vague symptoms that also improved. So there are a whole host of other things that people talk about all the time, other than the chronic diseases, that they feel better.
Excellent. Well, thank you for all that. So Let me ask you if you would share with us, besides diet, what are the other tenets, the other aspects of lifestyle medicine? So certainly diet is huge, and we've been talking about that, but what are some of the other things that people would really want to pay attention to?
Yeah, and thank you for bringing that up. And I think that diet is probably where you get the biggest bang for your buck. I don't think. I mean, that's what I really preach is that you get the biggest bang for your buck with the diet. But there are also other important aspects to your lifestyle that contribute to overall health and well-being. And the second one I focus on in most cases when I'm working with people is exercise. By the way, there's a lot of things to lifestyle, and we don't ask everybody to, when we're working with them on these things, we don't ask for, hey, to change overnight. You don't change everything overnight. I usually help people work in a stepwise fashion. We pick various goals one at a time and start moving the needle in the right direction. And then once you've accomplished one thing, then we work on the next thing. And so, it's not a overnight transition for most people. So, exercise is the next thing that I work on. I talk to people about um, both kind of the traditional cardiovascular cardio exercise and then also resistance exercise. Our recommendations is that people work towards getting 30 minutes of walking or power walking 5 times a week, but it doesn't have to be walking. You can do whatever resonates with you. Some people swim, some people dance, some people go hiking. It's what, it's really more about getting out there and moving and being active. As I mentioned to you in the Blue Zone thing, some people were gardening, and I think that counts as exercise. So it's just getting out there and moving and not being sedentary. It's getting off your bottom, getting off your butt, so to speak. Because today we live a very comfortable sedentary lifestyle, which doesn't encourage the same movement that we had. I think I read one statistic where that if you go back 150 years, we averaged 30,000 steps a day as a society. 30, and that was just the normal day because, they didn't have cars. You walked everywhere. And now today, the average is, I think it's less than 4,000. And, we have these, goals of getting 10,000. I'm not sure where that goal came from, but 10,000 is very reasonable. But for me, that equals 4 miles. And you don't even have to walk 4 miles a day. I think you'll see health benefits if you just get out there for 30 minutes a day and walk at a reasonable pace. So 30 minutes a day of walking 5 days a week or 150 minutes of exercise a week is important. If you want to change that into vigorous exercise, say you're a runner or a jogger or swimming fast or doing something that's a little bit more vigorous, that really gets your heart rate up, then you can drop that to 15 minutes a day, 5 times a week, so 75 minutes. And it's more important to spread it out rather than getting it. It's better to do it several times a week rather than just once a week. Don't get 75 minutes of vigorous exercise in once a week. Spread it out. And then again, I'm a real big proponent of finding what works for you. Some people enjoy walking and power walking and getting outside. Others prefer swimming. Others prefer dancing. So it's whatever's going to get you outside and get you doing something. And then I'm also a big believer that as we age, it's important to incorporate some resistance exercise into our program because our muscles naturally atrophy with age. And and I'm not talking about, we all our society is kind of tainted by the bodybuilder kind of approach. And I'm not talking about being a bodybuilder. That's really more people. I've seen more people injure themselves by trying to go out and do way too much. I'm talking about just getting getting out there and doing some regular resistance. It could be something as simple as doing some push-ups, sit-ups, and pull-ups at home, or you can be a bit more focused with some dumbbells and things and some things like that. But it doesn't have to be heavy weights. It just has to be something that gets your muscles stimulated and producing some muscle. So that's exercise is kind of the second pillar, which I focus on. And then there's other things that we also talk about avoidance of significant use of risky behaviors. and especially drugs and alcohol. The kind of the current acceptable standard for alcohol is no more than 2 drinks a day for a man and 1 drink a day for a woman. But in my opinion, limiting your alcohol to as little as possible or even no alcohol is important, because we know that alcohol is a toxic substance and does cause disease. It causes cancer and may be a contributor to atherosclerotic disease or cardiovascular disease. So, but different people land in different places as far as that's concerned. But I'm a proponent of no alcohol. And then certainly avoiding other risky and toxic drugs. And then there's other things such as sleep. Getting adequate sleep is very, very important for your health. We know that sleep is restorative, and then there are certain hormonal pathways in the body that are affected by our sleep, and so sleep is something else we focus on. And then, social connections and spirituality are also important. I saw that in the blue zones, and then we focus on that as well in one of the pillars, some of the pillars of lifestyle medicine. I told you I can be very long-winded in my answers.
Well, we appreciate your wisdom. You have so much great information. Everybody's loving it. Let me see what else we have here in comments. Miriam is saying that she had issue with asthma, and says she was given, and I can pronounce that, Remedis. I'm not going to try.
Remdesivir. Yeah.
Yes, thank you very much. And being active triggered up her asthma, and then she goes on to say that she has trouble walking even 2 blocks. Now, is this what impact do you think could? I mean, Miriam's eating pretty healthy here. What is there anything that can help her at this point, or where would you guide her if you and I don't mean to ask you for diagnosis or medical advice, but anything that comes up for you, and that might help her.
Yeah, that's a tough one, and I'm sorry to hear that. And obviously, we all have when we make these recommendations for lifestyle, we have to work with each individual and see, wherever they can go. Not everybody can do everything, and sometimes it's it sounds like you have some significant limitations, and it's just about a matter of finding what you can do and then just doing that. And even with your limitations, I say that it may be important to do what you can and do it on a regular basis, and then see if you can just slowly increase those numbers regularly. So if 2 blocks is your number, then just walk 2 blocks, or maybe find something else. Can you do a stationary bicycle sitting at home? Or and everybody, like I said, everybody has different places they're going to level out, and it certainly sounds like that maybe you might be able to work with a medical specialist, maybe in the area of pulmonology, who might be able to help you. And you're all, you sounds like you have the diagnosis, so probably you're already connected with them, but maybe work with them to see how they can help you improve your cardiovascular condition.
Well, excellent. You mentioned inflammation, and I've heard other times how inflammation is really central to so many of our diseases, and the immune system and is really what it's all about, right?
Yeah, the inflammation or immune system, it's part of our body's defenses, and so there's a good balance that's supposed to exist. They exist for a reason, and they're supposed to be there. But when they're overly stimulated, then they're bad for us. And I can, that's why I say that, our body, if our body's chronically inflamed, we don't feel well. And I think that if you go around and measure, we have a couple of measures of inflammation, general inflammation, which is the CRP and the SED rate. Most people are walking around with elevated levels. And you saw it in me when I changed. I have some good labs to show. I had some labs done about 6 months before I changed, and about 2 or 3 months after I transitioned. And my SED rate and my CRP went down to almost zero. And then so many of the other labs changed. But yeah, I think we're all walking around as a society generally uh, acidotic and more inflamed than we should be, and that's part of the all of those other things that improve when you improve your inflammation. What I can speak to inflammation from a cardiovascular standpoint as a really good example is that atherosclerosis, or the buildup of plaque inside the arteries, part of that process is an inflammatory process, and it has all of these inflammatory cells and defense cells that and immune system cells that are being recruited to the area of plaque buildup to deal with the problem. That problem is saturated fat and cholesterol. They get deposited and injure the arterial lining. And so we have an inflammatory response or a defensive response that goes there. All these cells and soldiers, or I call them the soldiers, and they get with their weapons, which are the hormones and the leukotrienes and different things like that. And they get recruited there to go and repair that injury, to defend against that offender. But what happens is two things. Number one, the inflammation or what happens is that we keep injuring that area, so they keep staying there. So instead of it just being a small war, then they clean up and they leave. It turns out to be an extended battle where there's lots of damage and injury to the area, which is the plaque buildup. And so when you keep injuring something over the course of your lifetime, the damage builds up and healing cannot occur. Whereas if you and that's something I'd like to talk about, is our body's natural desire to heal. And then we know that diabetes, for example, more than doubles the amount of inflammation at the microscopic level. And so when you're building up plaque inside your arteries due to cholesterol and saturated fat, if you have diabetes, that inflammation is even more than doubled. So the plaque buildup gets even worse. And that's why diabetics even get worse atherosclerosis than the others. And that's why it's important to control and or reverse your diabetes. And that's how, when you control and reverse your diabetes, it contributes to the reversal of atherosclerosis or cardiovascular disease. A nice way to think about the injury model is if you get a splinter in your thumb, it hurts, or a bee sting. Okay, look, either one, it hurts, and what happens is an injury has occurred. Okay, at a very small level, and our body then recruits the repair mechanisms and defense mechanisms. The immune system goes over there, and they start working, and it gets a little bit tender. And then, so for a few days, that area might be tender as our immune system and defense system is doing its work. But then as you heal, then they go away and you get better, and the pain goes away, the inflammation's gone. So that's where it's working appropriately, as opposed to what I just talked about at the microscopic level in the blood vessel. Another way to think about it is I talk about the story. If you put your thumb on the table and you hit it with a hammer and you walk away, well, the body will heal. But if you come back and hit it with a hammer every day, and you just keep every day, you just come back and hit it with a hammer, well, the body's trying to heal, but at the same time, you're injuring it over and over again. And that's what I say is that standard American diet is that chronic daily injury that we are doing to our bodies, and our bodies want to naturally heal. So if you stop the injury, you stop the bad diet, the toxic diet, and you eat a healthy diet, our body naturally wants to heal and get better and improve its overall health, both at the chronic disease level and all of those other kind of secondary symptoms, as I call them.
That is awesome news. That our body, in fact, is very powerful at healing and
It is.
naturally healing, and that's just to me, that's amazing and miraculous. Our body is, I mean, our body does millions of things all the time. I mean,
Mm-hmm.
constantly monitoring and repairing every cell and replacing the cells that need to be replaced, and it doesn't get confused. I've never heard anybody say, somehow my body put a toenail cell in my eyeball. How did that happen? So it's just
Well,
so amazing, isn't it, how our body heals?
Yeah, and I think that that speaks to a very basic level of what our body is. It's an amazing physiologic machine, and we have millions of processes going on every nanosecond. Okay, and it's in a harmonious balance, and it's what we've done is we're the ones knocking it out of balance by not taking care of it, and it naturally evolved with us as we evolved in a manner so as to be this, like I said, this amazing physiologic machine. But if we continue to do things on a regular basis to try to upset the apple cart, well, we knock things out of order, and we cause chronic disease, and we cause cancer. Um, there are natural things that occur to us as part of the aging process. That's why it's not we don't last forever. But you know what? I think we can last a heck of a lot longer than we do today by treating it better. And I get into a little bit of, I'm getting into a little bit of the anti-aging stuff now that I feel like I've really got the plant-based stuff down. And the funny thing is, at the basis of anti-aging is a whole food plant-based diet. So it's the same thing that's for health, is the same thing is for living a longer, healthier lifestyle.
Beautiful. Um, I have a question here from Marquita, and she says, "Is it possible to have diabetes without knowing it?" And she goes on to say that she knows someone who didn't know that they were diabetic and then all of a sudden had to get a foot amputated.
Yeah, really good question. And we don't talk about this enough. And the simple answer is yes. Okay. And then to speak further about that is that diabetes is a disorder in the management of our glucose. Okay. And uh, uh, so it can be going on for years. Okay. At a level where people don't know about it. Because it may or may not be causing a lot of symptoms until it gets worse. Some of the common symptoms of diabetes are frequent urination and thirst. Those are some of the early symptoms that can be ignored or not recognized, or somebody may not have those symptoms. So yeah, diabetes can be occurring under the surface for many years, and people can live with diabetes as for many, many years without knowing about it. And that's again where I think it's important to, we want to live healthy lifestyles, but that doesn't mean don't go to the doctor, or don't do something to kind of assess where your body's at. And that's why I talk about getting the data and using the data then to make the appropriate changes or focus on what you need to focus on. I think that the idea is if you, from a young age, the reason Maya and I do this outreach is not only do we work with my patients, but we do our outreach because we want to reach people when they're younger, before they have problems. So if you live this lifestyle from a younger age, you're going to get less of these problems that we're getting when we're older. But at the same time, it doesn't mean that you shouldn't be monitoring your body, checking it out, and working with the data as you get it. One of those being your blood sugar and your hemoglobin A1C, which are indicators of diabetes.
Well, thank you for that. It looks like we're coming towards the end of our hour. We're almost finished, and I'm noticing in the comments we have everybody sharing their appreciation for the information that you've given us. Vegan Knowledge JJ is saying thank you for the information, as has been Miriam and Marakita. Everybody's appreciating what you're sharing. I guess here, Vegan Knowledge JJ also said something about supplements D3 uh, and K2. Maybe as a last comment, would you comment on this? Uh, I've heard that just if there's time, she would like to hear more about D3 and K2 in conjunction.
Yeah, I'm aware of that thought process. I personally don't take the vitamin K2, and we're talking about getting pretty specific now as far as your overall health, and then focusing on kind of sub areas. And I have read some stuff on needing to supplement vitamin K if you do the vitamin D. And I can't speak to that too much, honestly. Haven't read enough on it. What I would say is that if you're, first, that's important, but what's really more important is a whole food, plant-based lifestyle. And then once you've mastered that, then you can again start focusing on the more smaller things, the tweaks, as I say. You're going to get the biggest bang for your buck with a whole food, plant-based lifestyle approach, and then start focusing on smaller stuff as you get that down. So for the general audience out there, I wouldn't worry too much about the vitamin D and the vitamin K as much as I would worry about changing my diet.
Beautiful. So, Dr. Riz, I know you're in the Dallas area, right? And you do walk with the docs and other activities. So, for anybody, would you like to share with anybody in the Dallas area how they can connect with you and join your community there, and where else they might be able to watch and listen to your advice?
Yeah, thank you, Peter. Yeah, so we both have a local outreach and then kind of a national thing, and we do a weekly. I'm sorry, a monthly walk with the doc, which is your opportunity to come out and just we get out and walk a 1 mile circuit, one, two, or three times, and in a nice park around a lake, and it's your opportunity to walk and just talk with me, and I present a little health topic for 5 or 10 minutes, and then we walk. And it's just a way to try to encourage my community to get outside, and we do that as a part of Walk with the Doc here in Dallas, and we do it on the third Saturday of every month. Right now, we do it at noon. We may move it up to earlier in the day as it gets hotter, and then we do kind of our outreach. I do some speaking engagements, and then we do other events. We're about to do a movie screening. So the best way to find out about what we're doing is to either go to our website or follow our social media. Our website, I'm going to tell you two names, plantbaseddfw.com and then healthylifestylesolutions.org. And I think that we're busy in doing some transitions. I encourage people to listen to Maya's podcast, which is Healthy Lifestyle Solutions Podcast. And I'm a guest on there regularly, and we talk about health topics and very specifically lifestyle stuff. And then my social media, the main one I utilize is Instagram. There's so many of them out there today; it's so hard to keep up with all of them. So we do have Facebook and LinkedIn, but my Instagram is the most important one, and it's Dr. for doctor _ Riz RIZ _ Bukhari. Bukhari. So if you want to join my Instagram, it's you just come. It's a public account. You can just come and join and follow along. And then lastly, I've got a guide on cardiovascular disease and nutrition. It's free. It's a PDF guide. It's free to download, and it's a bit.ly link. It's bit.ly / join Dr. Riz, all one word. So bit.ly / join Dr. Riz. So I would encourage you to go over there and download your free cardiovascular disease and nutrition guide. And it has some it has some of my healthy recipes, hibiscus tea to reduce your blood pressure and heart rate, my spinach and arugula salad, which the greens are very important for your heart health. And your blood vessel health. So those are kind of the main things. We have so much more, but I would encourage you to join our mailing list and our social media and follow along and join. If you're in the Dallas area, join us whenever you can. We'd love to have you. And then if you're outside of the Dallas area, again, the podcast is a great way to follow what we're doing.
Well, and we have thank you for all that, and we are a little bit past time, but Miriam is saying one more question, please. And so I'm noticing this. Clear my conscience. This sounds urgent about uh, saturated oil that says no cholesterol being uh, that may have said that saturated oil may cause high cholesterol.
Yeah. So, yeah, and I think I
Disease.
understand what Miriam's asking there. The so the I don't believe that we need any cholesterol in our diet, okay, because we make our own cholesterol, and we've proven that too. So for people who are on vegan diets and whole food plant-based diets, they're not cholesterol deficient. In fact, we know that the lower your cholesterol, the better your overall heart health is, and our liver makes all the cholesterol we need. Now, the other thing is that we've seen and we know in studies that high saturated fat intake increases your cholesterol level. Okay, so there's something about taking in saturated fat that increases the production of cholesterol in our bodies, therefore putting us at risk for cardiovascular disease. So by keeping your saturated fat low, which the primary source of saturated fat is meat-based products, so it's meat, cheese, dairy, and eggs. Those are the primary sources of saturated fat and the primary sources of cholesterol in our diet. By keeping those low to none, then you reduce your saturated fat, you reduce your cholesterol, and you reduce your risk of cardiovascular disease.
Well, excellent. Thank you so much. And your answers have been magnificent. And I think for many people, they're kind of the tip of the iceberg. There's so much more information, so much deeper to dive in, and being healthy is and healthier is an ongoing journey, and we certainly can improve things all the time and tighten up what it is we're doing, and it is miraculous. And thank you for all your uh, information, and we look forward to having you again. uh, We Did It.Health. So everybody, please go to We Did It.Health and join the community, create a profile, join our passion pods, and I look forward. Hopefully, Dr. Riz will be with us again to answer questions. This has been so amazing, and I so appreciate you and your time. And thank you, Dr. Riz. Uh, anything you'd like to say before
Well,
we
no,
go here?
I've enjoyed it. I'll be very happy to come back again, and you can do kind of some, these questions and answers are really nice, and I think it's a great starting point for people. But I've enjoyed it, and thank you so much for all the work that you're doing and what you're contributing to the health of our world. And so, look forward to seeing you again.
Uh, My pleasure. Thank you. And we look forward to seeing you again. So long, everybody. We'll see you next time. Bye bye.
Bye.